Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Okay, guys, so we are going to discuss hemophilia in pregnancy. So we know that this is an X-linked condition, and in this case, either the clotting factor is reduced or completely absent. Okay, and what sort of X-linked? X-linked recessive. So a female is going to be a carrier, always going to be a carrier. And if there is a female carrier, then there is a 50% chance that her a male baby will be affected. Okay, male child will be affected with an E, and there is a chance that her daughter will be a carrier. There's a 50% chance of her daughter being a carrier. Okay, now a female becoming pregnant, since she is only going to be a career, then why is there an issue? She is a career, she is not affected because careers have low levels of factor 8 or 9 depending on it. For 8 it is hemophilia A, for 9 it is hemophilia B. But they have low levels, and these low levels are the main issue during pregnancy. So what happens in pregnancy to factor 8 normally? What happens? Normally, during pregnancy, factor 8 increases. And what happens to factor 9? Factor 9 remains unchanged. So, if a female is a carrier, and I'm just like hypothetically, and if she is undergoing pregnancy, she also, because of being a career, she already has a low level of factor 8. But due to pregnancy, her factor 8 level will be increased. So there might be a compensation for her career status if she is a career of mild hemophilia. But if her career status is moderate or severe, then that compensation will not be significant. Okay. Now, so basically, let's say that we have a neonate, okay, and a neonate male, of course. We are being very, we are meeting the societal standards, and we're only talking about male children, and they are only important to us right now. So there's a neonate who is a male, and he is affected, but there is no previous family history. So what does this mean? This means you have to go back. This means that she has an affected mother. There's a 90% chance that her mother is a carrier, and we don't know. Okay, and there is a chance that the next male child will also be affected. Okay, so, in this case, the female is going to be an obligate career. Who is an obligate career? And woman is an obligate career for hemophilia A or B if her father has hemophilia, we go back, or if her son has hemophilia. So, if any of the males in her pedigree above her or below her have hemophilia, then this means that she is an obligate career, and we don't know that, but now we do because now we know the guidelines, right? Okay, so or if she has an affected relative on the maternal side, if she has an affected maternal relative. Okay, now the thing is that she is likely to be a carrier if she has a single son with hemophilia, or she is having a single carrier daughter. But it is not always the case. Okay, hemophilia can also be due to a new mutation of an offspring in a male. Okay, and this new mutation is mentioned in the guideline that it's basically 40 to 50% cases of severe hemophilia can be because of spontaneous mutation, and these spontaneous mutations they occur mostly during spermatogenesis as compared to oogenesis because of high cell turnover and unpaired X chromosome. So what will happen is that there is, let's say a new mutation happens of severe hemophilia, and there's a guy with that. So now his daughter is a carrier. He's affected, and now her son, his grandson, which means his grandson, is going to be affected. So, it just sporadically arises sometimes, and it gets transferred along the pedigree. Okay? So, this theory is correct in 90% of cases. So, now this was the whole theoretical portion of its definition and the genetics. Now, the thing is the levels. So, the levels are hemophilia can be the phenotype is either mild or it's moderate or it's severe. Mild is when it is from 0.06 to zero point 0.4. Moderate is when it's from 0.05 2.1, and severe and 2.01, and severe is when it is from less than zero point zero 0.01. Okay, so let's just go, retrograde. If it's less than zero point zero 0.01, the unit is international unit per ml. If it is less than zero point zero 0.01, then that is severe. If it is zero point zero 0.01 to zero point zero 0.05, then that is moderate. And if it is zero point zero 0.06 to zero point 0.4, then that is mild. So for mild phenotype, okay, if you know that the mother is a Korean, if you have diagnosed that the neonate has mild hemophilia, then in that case it's very important, because in mild cases you can do fetal blood sampling from scalp, and you can do fetal scalp electrodes. You can do these both things, but in moderate and severe category you cannot do these two things to the neonate. This is very important, that in mild you can do fetal blood sampling, you can apply scalp electrodes. Okay, so these are the different phenotypes. Now, what is the most significant complication? Now, let's say that for treatment you are giving concentrates. You are giving factor 8 concentrates to hemophilia A patients or carriers, and you are giving factor 9 concentrates to hemophilia B patients or carriers, and the patient develops antibodies to these concentrates. तो मतलब द किस्सा ही खत्म. ठीक है कि you are giving the concentrates, you are giving factor from outside, and now the patient has developed antibodies to that treatment. So this is the most significant complication, and these antibodies are known as inhibitors, and this occurs in 10 to 40% of treated patients and can be because of genetic or non-genetic. And once someone develops these inhibitors, then they can cause significant morbidity, and they require intensive management and are potentially life threatening. Inhibitor development in female carriers is extremely rare, okay, but it is a very significant complication. Now, so these were the three phenotypes that now we know. Now, what are the risks in pregnancy to mother and baby? So basically, the careers mothers are curious in hemophilia, and if she has a male child, then that is going to be affected. So the careers are also at an increased risk of bleeding. Okay, increased risk of bleeding with invasive procedures, with termination, with spontaneous miscarriage, and during the time of delivery. Okay, so we know that. And the male neonates who are affected, they are basically going to have iatrogenic bleeding, intracranial hemorrhages, and so this is also a serious case.